how can a more consolidated approach to physician staffing then in turn improve efficiency and cost control, some of the things that we just talked about?
Sure. No, appreciate the question, Lucas. I think ultimately what most of the health systems that and practices that we work with, they're looking for a Goldilocks zone. They understand the need for continuing to provide care immediately and being able to meet the needs of their communities in terms of overall procedure loads and things of that nature. But they're also looking for a way to be able to find that dynamic, that equilibrium of, okay, I have a locums, I have perm needs. How do I mesh those two and find that zone that is financially sustainable, but also allows me to be nimble for my community and my need? And so that's really the secret sauce and the magic, is finding that balance. What does that balance look like? And so providing some advisory services and certainly some outside perspectives can assist, but ultimately, I think it's based on the knowledge of the practice and the community itself on how they can sustain themselves and what type of support they would need and what that looks like.
Yeah, and I think what you've mentioned can only happen is what we've talked about earlier, right? It's really that communication piece, the understanding of the right partnerships. Okay, you know what I need, so that we can talk about it and bring that out and bring it back to it. Phil, I'd love to hear your perspective on this as well. Again, especially from a cost control perspective too, for organizations, this is key. How can these approaches really then in turn improve some of this?
So working with a good partner that provides you stable, qualified candidates that meet the clinical need and then can work the duration of whatever the necessary assignment is critical, because there's a considerable amount of administrative overhead that goes into, onboarding and credentialing staff. It's not as simple as, they hand you the resume, the doctor starts tomorrow. They have to be brought onto the medical staff. They have to be enrolled with the payers. They have to learn the system. They have, and until someone's really immersed in that system and comfortable, they're probably, less effective until they come to that state of equilibrium. So working with, good agency to find the right help can definitely cut costs and preventing some of that rapid turnover. It's also, I think, a major satisfier for, the existing staff that we have as well. You have familiar faces, you have comfort with their ability, and it's going to be okay with them in that case.